Did you know that diabetes could be silently damaging your body long before you even suspect it? The signs aren't always as obvious. In fact, most people ignore the subtle red flags, dismissing them as everyday annoyances. But these hidden early warning signs are your body's way of crying out for help. Are you unknowingly ignoring them? Today, we'll uncover the most overlooked early signs of diabetes and why it's critical to recognize them before it's too late. Welcome to Levitas. What are the most overlooked early signs of diabetes? One of the biggest challenges with diabetes is how quietly it creeps in, often presenting with symptoms that many people overlook or misattribute to other causes. For instance, blurry vision is commonly mistaken for needing new glasses, while frequent urination may be dismissed as a side effect of drinking too much water. However, these could be early warning signs of high blood sugar levels, disrupting your body's normal function. Another often overlooked symptom is unusual thirst. Many dismiss excessive thirst as simply a reaction to exercise, salty food, or heat, failing to recognize it as a potential red flag for elevated glucose levels. Even fatigue, a classic early symptom, is commonly written off as stress or overwork, especially in today's fast-paced world. What makes these signs so easily overlooked is their gradual onset. They don't scream diabetes right away. Instead, they appear subtly, giving the impression of minor, unrelated inconveniences. Recognizing these signs for what they are can make a huge difference in early detection and preventing complications. Why do sudden weight loss or gain signal diabetes? If you're experiencing sudden weight changes without changing your diet or exercise habits, it could be a sign of diabetes. Here's why. When your body can't effectively use glucose for energy due to insulin resistance or insufficient insulin, it starts breaking down fat and muscle instead. This can lead to rapid, unexplained weight loss. People often view this as a positive change, especially if they've been trying to shed pounds, but it's a serious warning sign that your body isn't metabolizing nutrients properly. On the other hand, sudden weight gain can also be linked to diabetes. High insulin levels in the blood, a hallmark of type 2 diabetes, can trigger fat storage, particularly around the abdomen. This type of visceral fat is not only difficult to lose, but it also increases the risk of further insulin resistance, creating a vicious cycle. Understanding these sudden weight fluctuations as potential symptoms rather than normal variations can help identify diabetes early, especially when combined with other signs. Why does fatigue happen? Fatigue is a common complaint, often attributed to poor sleep, stress, or a busy lifestyle. But in the context of diabetes, it's more than just tiredness. It's your body struggling to get the energy it needs. When blood sugar levels are too high, glucose remains in the bloodstream instead of entering cells to be used as fuel. The result is persistent exhaustion, no matter how much rest you get. If this sounds familiar, it's time to consider whether your fatigue might be a hidden symptom of diabetes. How recurrent infections indicate diabetes? Frequent infections, such as urinary tract infections or UTIs, skin infections, or oral thrush, are a lesser-known yet significant early sign of diabetes. High blood sugar creates a favorable environment for bacteria and fungi to thrive, weakening your immune system's ability to fight off these invaders. For example, individuals with high blood glucose levels often experience recurrent yeast infections. This occurs because the excess sugar in the blood and tissues acts as fuel for fungal growth, particularly in moist areas like the mouth, genitals, and underskin folds. Similarly, diabetes slows wound healing, meaning even minor cuts or scrapes can take an unusually long time to recover. This happens because elevated blood sugar levels impair circulation, reducing the supply of oxygen and nutrients to the affected areas. Recognizing these patterns of recurrent infections and slow healing could be crucial for early intervention. Do you find yourself constantly hungry, even after eating a full meal? This could be an early sign of diabetes, specifically caused by the body's inability to process glucose properly. In type 2 diabetes, insulin resistance prevents glucose from entering your cells, leaving them starved for energy. As a result, your brain receives signals that you need to eat more, triggering intense and frequent hunger, also known as polyphagia. Ironically, eating more doesn't resolve the problem. Without proper insulin function, the glucose from your food remains trapped in your bloodstream, further exacerbating high blood sugar levels. This creates a vicious cycle of overeating, energy depletion, and metabolic disruption. Recognizing this unusual hunger as a potential warning sign can lead to earlier diagnosis and better management of diabetes. What's the link between diabetes and darkened skin? One of the more surprising early warning signs of diabetes is the development of dark, velvety patches of skin, often on the neck, armpits, or groin. This condition, known as acanthosis nigricans, occurs when high insulin levels stimulate the growth of skin cells and melanin, resulting in thicker and darker areas of skin. Although harmless on its own, acanthosis nigricans is a visible marker of insulin resistance and often precedes a diabetes diagnosis. If you notice these changes in your skin, it's worth consulting a healthcare provider to investigate further. Are tingling hands and feet an early sign of diabetes? Tingling or numbness in your hands and feet, known as peripheral neuropathy, is another common symptom of diabetes. High blood sugar levels can damage the small blood vessels and nerves, especially in the extremities. Over time, this can lead to a loss of sensation, making it difficult to detect injuries or infections. The tingling often begins as a mild, occasional discomfort, but can progress to chronic pain or complete numbness if left untreated. This nerve damage isn't just a symptom. It's a warning sign of the long-term complications diabetes can cause if blood sugar levels aren't controlled. Peripheral neuropathy can also affect your balance and coordination, increasing the risk of falls and injuries. Recognizing this symptom early on and seeking medical attention can help prevent further nerve damage and improve your quality of life. In conclusion, diabetes often sneaks into people's lives with symptoms so subtle they're easily dismissed or misattributed to everyday stressors. Early signs like blurry vision, frequent urination, or unusual thirst are commonly brushed off as minor annoyances rather than red flags for high blood sugar. This is compounded by the gradual onset of these symptoms, which can fool people into a false sense of normalcy. Recognizing these patterns, however, can be life-saving, as catching diabetes early helps prevent its dangerous complications. Sudden weight fluctuations, whether loss or gain, offer another telling clue. Weight loss may result from the body breaking down muscle and fat for energy due to its inability to process glucose. On the flip side, weight gain often stems from high insulin levels, promoting fat storage, especially in the belly area. Both changes highlight a deeper issue with energy metabolism that shouldn't be ignored. Fatigue is another commonly misinterpreted sign, often excused as stress or lack of rest. Yet, in diabetes, it reflects the body's struggle to access energy, leaving cells starved despite elevated blood sugar. Similarly, recurrent infections and slow wound healing signal high glucose levels compromising immune function and circulation. Other seemingly unrelated symptoms, such as darkened skin patches, known as acanthosis nigricans, or tingling extremities from nerve damage, further underscore the silent but systemic impact of diabetes. These clues, when pieced together, paint a clear picture of a condition that thrives on being overlooked. Recognizing them early can empower individuals to seek timely intervention, improving outcomes and quality of life. Thank you for tuning in to Levitas. Please share today's video with friends and family, give it a thumbs up, subscribe, and hit the bell icon to receive notifications for future videos. Your support is appreciated. It helps us grow and create more content to empower your health. Remain tuned to Levitas for more expert advice on your health and fitness journey. So stay healthy, stay happy, and keep going.